after hours. We're in Dr. Wilson's super clean office.
As you can see.
It's very plush.
It's so nice.
It has that lived-in look, you guys.
Sure it does. There's snacks here.
I heard the messier office, the smarter person.
Yeah.
That's absolutely true.
Yeah.
100%.
I'm serious.
I know. I'm
Now see my closet at home.
Yeah, oh, I'm sure. So it's Infertility Awareness Month. We're here with Dr. Wilson, and we're gonna talk about some infertility.
Dr. Wilson, I heard you like to get people pregnant.
That's why I look like this now. I'm worn out.
Oh, Lord.
Okay, so
Who told you that? I like to get people pregnant.
well, she might have been in the hall at times when you are yelling down the hall. Don't forget who got you pregnant.
Oh yeah.
Oh yeah.
I have had a couple kids named after me, so it must be.
Really?
Yeah, I have.
Yeah, I think that's valid.
You do?
Well, if he helps you
Yeah.
get pregnant,
I should get my name right.
sure.
Sure.
Not paying child support though. But
Little baby Jimmy James.
yeah. Oh, yeah.
Okay. Anyway, so disclaimer. This is just it is educational, and Dr. Wilson is a doctor, but he may not be your doctor, or he might be. But this isn't medical advice for anyone in particular. If you hear something on here that you think that you need to go talk to your doctor about, and Dr. Wilson's your doctor, or he's not, go talk to him. He's got snacks.
He has a lot to offer.
Anyway, all right. So let's talk about fertility. If someone comes to you and says, "Hey, Dr. Wilson, I'm ready to start a family," what advice do you give to them?
Don't.
Those kids are bad.
Dude, I'm telling you, just practice. You don't want to have kids on your own. Borrow them first.
You have to
You
have
got
a
any
test
kids, Jay?
run. You can take a test drive. Drive kids?
Yeah.
No.
She's 5 years old.
Well, then, I'm just telling her before she decides to have kids, she needs to go try them out first.
Okay, she doesn't.
She can rent them.
She doesn't want to
Where
have
can
kids.
I rent them? Where can you rent a kid?
Just
before
come
you
here
get
anytime.
pregnant?
You can rent any of the kids that show up in this place.
Yeah.
The patients come
I feel
walking
like I
in.
never see kids in this place.
Oh my God, they're here all the time.
There's kids.
There were
Baby
3 here.
babies.
Yeah.
Yeah.
They bring them in for the postpartum visit. They have to bring the finished product in.
Sure.
The
Yeah.
finished product.
Yeah.
The masterpiece.
Once
Yeah.
it's fully cooked.
And then you can see how tired they are and miserable they feel, and then that'll
I know, but
prevent you from wanting to have children.
But some people really, really want to have
Oh
kids.
no, that's true.
So, and because
What was the question again?
the question was, oh my gosh, if someone comes into you and says, "Hey, Dr. Wilson, I'm on birth control, but I'm married now, and I think that I want to have a baby." What advice do you give them?
The first thing, ask them if they know where babies come from.
Yeah. Okay.
Simple question.
Do
Okay.
people know where babies come from?
Some do, some don't.
Some do, some don't. So,
Well, what's it take to get pregnant?
what does it take?
A man
Takes
and
a
woman.
sperm and an egg.
Sperm, egg,
Mhm.
and a chance to meet.
Okay. How do you make that
And
happen?
luck. Yeah, there's some luck in there.
A little bit of luck.
Yeah.
And what do you tell them?
Good luck.
Basically, good luck, yeah.
He says,
What?
"You just gotta get close."
No, that comes in the later spot.
Clearly, you want numerous visits with this guy because you want to get the full effect. If you want it all,
No, but you're right. You do. You just got to get it close.
right.
And I don't care how you do it. Just get it close. That's all it takes.
Okay. So we tell people have sex every other day, twice on the weekend. Correct?
Twice on the weekend.
Well, it's the weekend, right?
Okay. Right.
Do you say that to people?
What do I say to people?
Oh, you say a lot.
No, I just tell no. You have to time it right. Now, if that means 3 or 4 times a day, if that means 3 to 4 times a week, I don't care. You just have to time it up.
Okay.
Okay.
Okay. So that was my next question. How often should you be having sex to actually conceive? And if you're
Well, now wait a minute.
Well, it can take one time.
it could take
But it
one
Could
time.
well, it could be you could be unlucky and do it once.
There have been a lot of years that I was really trying not to get pregnant.
And
So
maybe it worked.
and it worked.
So, if you ask the guy every day,
Okay.
you got to have sex every day.
All right, every
If you
day.
ask her, not so much.
Every other.
Is there any evidence that sex every day will increase your chances of pregnancy? The answer is no.
Right.
Okay. But if you're not documenting ovulation, you don't know when you're ovulating, and you're probably ought to have sex every day. So hopefully you get
Your
lucky.
chance.
Well, it turns out I did do a little research, and those sperm can live in there for about 7 days. So
We always tell them 3 to 5.
they might be living in there.
They
for
start
a
running
week.
out of fuel, after a little while, and then they can't.
They
can't live.
They might set up shop.
Okay, how long's the egg good for?
The egg is only good for like 24 hours.
Good. 12
Oh.
to 24.
You're gonna pass.
I'm gonna be a nurse practitioner.
Steph's studying for her test.
I'm
Right
studying.
now,
We're gonna start quizzing Steph instead of me.
Oh, yeah.
Yeah.
This is on you
I didn't
now.
do my research. The egg lives for 24 hours. So
Yeah.
if you kind of know when you ovulate, if you're having regular periods, so that's one of the other things. If you're not having regular periods, you got PCOS or something like that going on, you need to get in and get that situated first.
Well, yeah, because if you're not having regular periods, you're likely not ovulating.
Correct.
Remember, what do you need? Egg, sperm, and a chance to meet.
There we go.
Even
Okay.
Hayden knows that now.
Yeah.
Hey,
I
look
got
what
it.
you've
See how simple that is?
Look what you've
I'm
learned,
gonna be
Hayden.
a doctor.
Right. Maybe you're next. Okay, so biggest fertility myths, just certain sex positions, putting your legs in the air, not going to the bathroom, what else?
Is that all BS?
Pretty much. He said if you want to put your legs in the air, put your legs in the air.
No, seriously, yeah, I don't care what you want to do.
But is that a real thing? Well, I know people do that, but does that actually help?
The idea behind that position is to keep the sperm from spilling out.
Uh-huh.
Oh my
So-
goodness. They're swimming. They're not going to
Girlfriend, if you stand up too
Yeah,
soon, you roll over, it all comes out. You guys make a mess. You gotta go change the damn, sheets, whatever. So if you have to lay with your legs up in the air for a half hour, do it. Now, do you seriously got to do that? No. The sperm gets up there very quickly.
Yeah.
Okay. That's why we tell you girls if you're having sex, you're not using birth control. Don't think you're gonna run off to the bathroom and stick a hose up there and spray it out.
Right. It's
Okay,
not.
It's
too
already
late.
there. It's already there.
No,
Yeah.
it
Too
gets
late.
up there quickly. But there are some people that if they do have problems with losing some of the sperm, keep your legs up. I don't care.
If it makes
Whatever you want to do.
If it makes you happy, do it.
Once again, just get it close and keep it there.
So 12 months, unprotected intercourse, someone under 35. that's
Healthy, regular
under,
periods.
Under 35, having regular periods, should conceive. If we don't conceive
After a year.
then we start looking into things.
Potential causes.
Right. If you're over 35, 6 months.
Mhm.
Okay. So that happens.
That's because your fertility rate's running out.
Correct. You only have a certain number of eggs.
Get in here. Get it taken care of.
Yeah, right. So you have a certain number of eggs, come in, you're under 35, trying for a year. Dr. Wilson, we've been having sex all the time. I'm putting my legs in the air. I'm doing all the things.
That's more information than I need, but okay.
I'm doing all the things and I'm still not pregnant. First step would be.
Oh, you ask tough questions. No, we're going to do a complete history on you. Okay.
Mhm.
Try to figure out whether it's her or him. Okay. Or whether it's just unexplained. Okay. Most infertility, if you look at the numbers, is likely related to the female for one reason or another. 25 to 30% can be related to the male.
Correct.
Am I right?
You are
I got one right? To me,
Don't look
girlfriend.
lights up.
How do I know you're right? That's what you're studying. Stop studying. Sorry. But then you can have another, we'll say 30% that could be unexplained. Means we don't know why.
Right.
So
things we can do, obviously any history of STIs or pelvic inflammatory disease, need to get that taken care of. Make sure those tubes are open, patent, all those kind of things. Make sure you're ovulating, right?
So how do you know whether or not you're ovulating?
Don't they make test strips?
Yeah.
Hayden.
Hayden, no. You trying to get pregnant, Hayden?
No.
Don't
She
worry.
knows these things.
You can buy those at the store.
Yeah.
But people do get really hung up on those test strips.
Mhm.
So, yes.
Yeah, but remember, that test strip tells you that you're about to ovulate.
Mm-hmm.
Okay, which is a good thing to know. Those apps that you guys always have on your phone that I'm always battling with only tells you where you're likely to ovulate based upon how often your periods come.
Right.
Those aren't telling you you actually are ovulating.
Right.
What about
Big difference.
the Oura Ring
Oh,
temperature
don't
taker?
even
No, those are a
start
pain
with
in
me.
the ass. Don't do it.
Okay.
No, those checking temperature, it's hard to read those. Okay, you're going to
Okay.
go nuts. Same thing with checking cervical mucus. Some
Well, by the
ladies will
time
do
your
that.
temperature raises that 0.5 of a degree, you already ovulated. It's
Oh.
after the
Okay.
fact. It's due to that rise in progesterone.
Hmm.
Right, buddy?
You are so smart. That's the LH surge,
Yes.
which is what those ovulation predictor kits are measuring.
Correct.
And that usually will occur 36 hours before you're going to ovulate.
So you got to get cracking.
Yeah.
Well, theoretically, yeah.
Yeah, you got to get
But
cracking.
remember, that egg's good.
Get those legs in the air.
Whatever it takes.
Okay,
I
all
don't care
right.
what it takes.
So,
So when you come in, so we got to do a complete history. Let's
Mhm.
figure out what's the likely reason why you're not getting pregnant.
Okay.
If you've got irregular periods, you're not ovulating on a regular basis.
Right.
Good luck getting pregnant.
Yeah.
Because
Let's fix
when do
that.
you time things? Okay. Number one. Number two, how do we even know an egg's coming out? Okay. We don't. Okay. So that's the very first thing we ask is, what are your periods like? Are they coming, every 28 to 30 days, which roughly is a normal cycle for a woman. It can go anywhere from 21 to 36 depending. Okay. But got to know, where you are with your cycles. Okay. So that's the first thing we ask. Next thing, then you can start to ask, okay, any problems with previous pelvic inflammatory disease, chlamydia, gonorrhea, these kind of things that will actually affect the fallopian tube. Okay. And why does that cause infertility, Hayden? Having chlamydia or gonorrhea, what happens?
I have no idea.
No, you weren't there. Were you there when didn't you go to Jackson?
Yeah.
I lectured you guys one day in there for health class.
Hayden, did you not?
You probably were asleep.
You know what? She was out behind the bleachers.
She probably was.
Right. Not getting pregnant.
That's terrible.
Just kidding.
No.
She was not. She's a good girl.
No. Inside the fallopian tube are hairs. They're called cilia. And what they do is they sweep the egg. So when the egg pops out, tube grabs it and it sweeps it down. Chlamydia, mainly chlamydia, will actually damage those hair cells. So they don't work. So the egg doesn't get down to where it needs to go.
Yeah, try not to get chlamydia.
So it causes that, but then it can also obstruct you. I used to have these really nasty pictures I would take to the high school kids to show them. Yeah, it was pretty cool.
Yeah.
You see what chlamydia does to your body. It's pretty nasty.
It's not good.
So we need to know if you've had any previous history, or have you had a tubal pregnancy. Same thing. You've probably got some tubal damage there, and that's why you end up with a tubal pregnancy. Do you have a history of endometriosis? If you know what that is.
Right.
That can cause inflammation in the pelvis. That inflammation can attack the sperm in the egg, cause problems. It can cause the tubes to be blocked. It can cause big cysts in the ovaries. It can lead to ovulatory problems.
Yeah.
Okay. So.
But sometimes it's the guy's fault.
Oh yeah.
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 So
good luck convincing him of that.
So when do we do the semen analysis? We've got her straightened out. She's having regular periods. We're still not getting pregnant. Let's check him out.
Well, yeah, I think every couple that has a history of infertility, the man should be evaluated because that's an easy test to do, right? And the problem is most men have no idea that they have an infertility issue because why would they?
Right. Is there any truth behind like the heat situation, tight boxers, like any of that stuff?
Well, remember that's why the sperm are on the outside because they do respond to heat. Now it would have to be excessive heat. You know, wearing tighty whities ain't causing the problem.
Okay, but probably don't wear them.
What's wrong with tighty whities?
I don't know. Wear what you want, I guess.
No. Now, if you're somebody that we know has a sperm count issue or something like that, then yeah, you want to optimize it. So either go commando or wear boxers.
Like air that out a little bit.
Air it out a little bit, yeah.
Okay. So hormones and other labs will be tested just on a case-by-case basis. So we're going to look at your history, make sure, see if you've had any of those STIs, see if you've had surgeries on your tubes, ovaries, uterus, anything like that. Make sure everything's working okay, and then go from there if we need to.
So basic workup, you're right, history and physical, irregular periods. Usually if she has irregular periods, I'm getting labs. If you have perfectly normal periods every month, and you're somebody that's documenting ovulation, those labs aren't going to tell me anything.
No.
Okay, you're wasting your money. Okay. So case by case basis, depending on, and particularly on the age. If she's older, then yeah, I got to check labs because she may not have the best ovaries to begin with.
Right. So we can look at like ovarian reserve and things like that
Correct. So labs plus or minus depending on her history. Semen analysis, absolutely. Okay. And that's not an expensive test.
No.
Okay. Now, I do tend to try to, if I can, avoid the HSG if possible. And the reason for that is you have to go to the hospital and the radiologists have to do it. The radiologist ain't being anywhere near your vagina.
And what is
okay?
Explain to us an HSV.
HSV, no, that's
Not HSV.
Yes, that would be
That
an
is-
infection.
that's
Yeah, I was
herpes.
gonna say.
No, HSG, hysterosalpingogram. Okay, that's where you take a little tiny catheter. It looks like a piece of angel hair pasta.
Mhm.
It's skinny. You stick it up inside the cervix, up into the uterus, and they're going to inject dye.
To see if those tubes are patent.
So when they inject the dye, what it does is it goes up inside the uterus so they can make sure the uterus looks okay.
Mhm.
But then it's going to go out through the fallopian tubes. And what they want to do, they want to see it spill out through the fallopian tubes and see it go all over the abdomen. That's how we know the tubes are open.
But in office, you can do the SIS.
Well, yeah, but the SIS is done to look at the uterus to make sure it's normal. There's something called a bubble test.
Okay.
And what you do with that is it's the same infusion, but what you do then is you take your syringe and you just squirt air up inside, trying to create bubbles inside the uterus. You want to see those bubbles flow out through the fallopian tube, and while your tech is doing ultrasound, you're supposed to be able to see those bubbles.
Right.
I've never been able to see them.
Oh no. Okay.
So we typically rely on the HSG. The problem is that when the radiologist does it, you have to push that dye in very slowly, because if you don't, the uterus will contract down, spasm, the tube spasm, and you have a false test that says your tubes are blocked. They're not. Okay? They're not likely blocked.
Okay.
But once you do that test and you say your tubes are blocked, well, now are they really blocked or not? So that's the problem. We used to be able to do those at the hospital all the time. Okay? We know how to do them. We push it very slowly. But then the timing issue, trying to get that scheduled at the hospital was a nightmare, so we couldn't do it. So the radiologists are typically doing it, and it's not a reliable test.
Are you ordering them on any type of frequency? Do you still order them?
Yeah, but once again, it depends on the history.
Yeah.
Okay.
If she's not having normal periods, I ain't doing it.
Mhm.
Okay, because it's an uncomfortable test. It hurts, and I can't rely on it to be accurate.
Mhm.
Gotcha.
So now, if she has regular periods, history of chlamydia, gonorrhea, endometriosis, anything that might suggest that the tubes might be, I gotta order.
Then we gotta know,
And then I gotta
because
keep my fingers crossed.
we have an inkling that could be the issue.
Mhm.
Yeah, if those are things.
Yeah.
Okay. We talked about ovulation predictor kits versus basal body temp. We know how you feel about that. Lifestyle changes that would make a difference. Obviously, normal BMI. Don't smoke. Limit your alcohol. Or if you're trying to get pregnant, you should not be drinking at all. I mean,
Well,
it's for
do
the
you want a
baby.
baby?
It's for the baby.
So probably the biggest thing to do is lose weight.
Yeah, get your
Okay.
BMI.
Get your BMI because infertility is definitely linked to insulin resistance, which you can see in folks that are heavier. Okay. Plus, being obese and pregnant significantly increases the risk of complications during pregnancy that I don't want to deal with.
Right.
Okay.
Gotcha.
So for your own health, try to lose the weight. Now, are you going to get down to 120 pounds? No, and I don't need you to. But if you're 300 pounds, for goodness sakes, get down to the low twos if you can.
Okay.
Don't always work that way. Okay. But definitely losing some weight can help those eggs start to function better, or the ovary better. Get those eggs to pop out, and then you'll likely have a higher success
Have
rate.
an easier time getting
Now,
pregnant.
smoking, quit smoking. Why the hell are you smoking in the first place? Okay.
Right.
There's definitely some evidence that it can affect sperm quality, egg quality, those kind of things. Same thing with alcohol. Okay. So just, before you get pregnant, try and get yourself healthy.
What's the drink you're allowed to have a glass of wine while being? Is that true? You can have wine while you're pregnant.
I could tell you a funny story with my own wife about getting pregnant and wine.
Well, my mom found out super, super early, like with me. So she was gonna take the test the day after the day she actually did, because she got pregnant so easy with me. And so she was like, she took the test a day earlier than she was going to tell my dad. She found out she was pregnant, and she drank a bunch of beer that night because she went out with her friends. She's like, well, if I would have taken the test tomorrow, I wouldn't even know today. Like, okay, girl.
I mean, I didn't know with my last one till I was. Yeah. Yeah.
Most ladies are drinking, they have no idea they're
She's
pregnant.
fine. It was early.
I know. I was
she's
like,
fine. She's super smart.
Yeah.
She's fine. That doesn't mean you go.
That doesn't mean.
It doesn't mean that that's okay.
Really are pretzels.
I wasn't trying to get pregnant. All right.
No, and the problem is you can't do a study to find out what's the safe level of alcohol,
No.
right?
Yeah.
Right. So,
Because it would be unethical.
right. We're not going to
You drink as much as you want and get
want-
pregnant. Steph doesn't. Let's see whose kid turns out normal, right?
Yeah.
Let's
You
not
couldn't do it.
Let's not do
No.
it.
No. So we say no alcohol. Can you have an occasional drinker? The answer is,
Okay.
but
But
not medical advice. I'm advising against it. Okay.
but don't do it.
But I've been doing this 32 years, and I don't know if I've ever had a child born that had fetal alcohol syndrome. I mean,
Yeah.
the number of drinks that you would have to drink
Knock on wood.
per day
Yeah.
is astronomical.
Okay, buddy.
But once again, we don't live
No,
in a
once again, let's not.
Okay. Okay. Moving on. So caffeine. Do we care about caffeine? We say limited 200 a day. 200 milligrams a
What's
day.
that? A cup of coffee?
Yeah.
So the thought there is excessive caffeine can lead to increased risk of miscarriages.
Mm-hmm.
What's that level? No idea.
We don't know. So we don't want to. I mean, don't sit around drinking energy
yeah.
drinks all day.
No, exactly. 5 hour. Yeah, no, don't do that kind of stuff. But if you want to have a cup of coffee during, the day or 2 cups, that's fine.
Yeah.
Okay.
Okay. Don't kid yourself into thinking that's causing your problem.
Yeah.
Right.
Yeah.
Okay. And then, so fertility after 35.
That one got to be more aggressive.
Yeah.
Treatment, because your biological clock is, winding down.
It's winding
Unfortunately.
down. Yeah.
And for most of you ladies, you guys have a career, which is wonderful, but waiting to have kids can create a problem.
Sure.
Mhm.
So if you're over 35, needing to get pregnant, get in here, get it figured out.
Yeah, I wouldn't go more than
Make
6
sure your
months.
periods are regular. Get off your birth control. Don't go past 6 months. Trying whatever. Okay. What about egg freezing? Who should consider it?
Well, I mean, anybody can consider it. I mean, you're seeing that a lot now just because, you have a career going.
Mhm.
People are waiting. Obviously, people that have cancer treatments or whatever, and they're young.
So I'm going to tell you an interesting story.
Let's
This was
hear it.
I wish I could find that. I got a picture somewhere. Anyhow, years and years and years ago, I had a woman come in from New York. She got pregnant in New York, and her story was that she had, I believe it was lymphoma.
Okay.
Okay. And she got it young. She was in her 20s. And before they gave her chemotherapy, they removed her ovaries and froze them.
The whole ovary.
The whole ovary.
Oh wow.
Froze
Okay.
them. After chemotherapy, they then implanted the ovaries underneath her belly button.
Stop it.
True story.
Wow. They worked.
The plan was to then stimulate those ovaries to get the eggs to grow, and then they were going to suck them out through her belly button.
Wow.
Pretty wild, huh?
Uh-huh.
Yeah.
She got pregnant on her own
With those ovaries.
in her belly button.
Stop it.
Where
So
does
you
baby
tell me
come
how
out?
that egg.
Hayden.
What'd you say?
Where does the baby come out?
The
I'm
belly
not gonna
button.
tell you. Yeah. So that egg made it all the way from the belly button all the way down to the fallopian tube that grabbed it and brought it in. Unbelievable story.
That is crazy talk. Yeah.
And she was on the Today Show. They were
Oh.
following her. So the Today Show shows up here from New York City.
What?
Cameras blazing, man.
So this isn't your first rodeo.
No.
We
This
gotta
is kind
pull
of
that.
wild.
We got to pull the tape.
Well, no. So yes, but I know I got that picture. I should find it. It's a true story.
If you find it, we'll post it.
I will. I'll put it up there.
All
But
right.
anyhow, yeah. So they came in, filming everything. But to make a long story short, I ended up delivering her with forceps. I'm like, oh man, don't mark up this kid's face because it's gonna be on national TV. Right? The morning we were supposed to go on the Today Show is when the hurricane hit down there in New Orleans. Bumped us. Never heard from them again.
Oh, we don't have any
Isn't that
tape
terrible?
to pull.
Yeah.
No tape to pull.
No tasteful.
Well, this is your.
I got articles in the newspaper,
Yeah.
but just goes to show you, okay,
Mm-hmm.
that the human body can do amazing things.
Right. You just
Right.
got to get close.
You just gotta get close.
So if we figure out that we're not ovulating, there's medications for that.
Hmm?
Right now we're using letrozole.
Well,
Is that your
the
go-to?
main drug is
Start-
Clomid.
Right.
Okay, now, basically all that does is trick the brain into sending more stimulation down to the ovaries to get the eggs to grow. Clomid is the standard one we use, but we're using letrozole more and more because that's been found to work better in ladies with PCOS.
In my textbook, it happens to say now letrozole's first line
For PCOS, thank you.
for infertility.
on who you read. Why are we whispering?
For textbook purposes. You do you though.
A little bit of knowledge can be dangerous.
Okay, so either one. So you'll decide, obviously.
Yeah, so
what
now
you're
here's the kicker. Okay, the difference being that clomid, you have a higher risk of multiples.
Mhm.
10% chance of twins, less than a 1% chance of others.
Mhm.
Okay, because it can really stimulate. The other problem with clomid is that it can thin the lining of the uterus.
Mhm.
So even if those eggs are popping out, if that lining isn't thick inside the uterus, there's not a nice soft pillow there for that embryo to implant on, and you can run into a problem.
Mhm.
So that's one of the reasons why we monitor the cycle when they're on these drugs.
Okay. Perfect. Okay, so it can happen. You can do it. You can do it.
What, get pregnant?
Well, not
Well, I hope so.
Not personally, but you can get other people pregnant.
I can do it, man.
All kinds of ways.
Yeah.
There's all
We
kinds.
got options.
We
Now,
got options.
are we going to talk about who needs to go off to the big folks or what?
Well, we can talk about it. Let's talk about MFM.
Huh?
No, fertility.
Yeah, not MFM.
Not MFM.
They're once you get pregnant.
Fertility.
So who needs to go see fertility people? The ones I can't get pregnant.
Well, we're not inseminating people here.
No.
At this office. You would go to the fertility.
So, if you have a bad history, meaning I think it's going to be hard to get you pregnant with just the stuff that we can do here in the office, I'm shipping you off to RGI. That's the reproductive guys.
Which is
because they're going to have to do some of their magic to get you pregnant.
And then that's who can do egg retrievals, IVF.
But that's where the big bucks come in.
Right.
Guys.
So you start with your OBGYN and you talk and you
come up with a plan.
You come up with a good plan.
Correct. And that good plan may be nothing here, you're out of here.
Like, sorry, you have to go.
I'm not going to waste your time.
Yeah.
But once they are pregnant, once RGI gets them pregnant, or they do IVF, or they do IUI, or whatever, however they get pregnant, then they come back and then get their treatment.
Right, but they'll come back.
They'll have all their pregnancy.
Yeah, they come back to us, let's say around 10, 11 weeks, something like that. Once RGI is confirmed that, they've got what we're going to call a good pregnancy, good heartbeat, good embryo growth, they're shipping you back.
Okay. Okay, so a lot of things that can be done right at your OBGYN. Perfect. And then the only other thing I wanted to ask was, people love to talk about progesterone and that how they need it, and so gave them progesterone and it really kept them pregnant, and I understand that progesterone does help in early pregnancy. Who needs it, who doesn't?
Good question. That was basically to be for patients that have what's called a luteal phase defect, okay, which just simply means that your progesterone level is not enough to support the lining of the uterus to be able to support a pregnancy. The problem is, if you read the powers that be that write the textbooks, they say it doesn't exist.
Luteal phase
doesn't exist.
Defect does not exist.
Not likely. Not enough to cause a problem. But you'll always read about somebody who, usually what happens is you get somebody who's infertile or has recurrent miscarriages, and we just start trying anything to try and get them to stay pregnant.
So a little progesterone isn't going to hurt you.
It's not going to hurt you.
So, okay.
Not going to hurt.
Because that's what's on.
But don't get so transfixed on it that you absolutely need that.
Right.
Because if you go on progesterone at work, does that mean it really worked, or
who knows?
You don't. Exactly.
But it didn't hurt anything. Just like putting your legs in the air. Did it work? We'll never know.
Might have been, man.
Yeah. We'll never know. We'll just try to get it close.
Well, yeah.
And put your legs in the air if you want. Use progesterone if you think that
I'm not going to. Yeah, exactly. And I'm not going to battle with somebody who I don't think needs progesterone when they're fixed on the idea that they need it. Not a big deal. It's really not. Okay. So we'll put them on that. We used to use progesterone in the past to try and prevent, early deliveries and everything. But after all these studies came out that said it worked, we had more studies come out that said it didn't work, so we stopped doing it. So medicine's constantly changing.
Okay. All right. So get your information from a reputable person.
Yeah.
Yeah. And if Dr. Wilson is your doctor,
good luck.
Right. Ask him for a pretzel next time you come in.
Pretzel.
Do you have anything else to say about infertility?
Yeah, I hated infertility when I was a resident because it was so frustrating that you would go to the infertility clinic, and everybody who did everything right couldn't get pregnant. Then you went to the clinic, and everybody who did everything wrong
Right.
had multiple kids.
Of course. That's always how it happens.
It's frustrating.
Yes.
It causes huge stress in families.
Yeah.
It's a big cause of marital problems.
Sure.
Okay.
Depression, all kinds of stuff.
They claim as high as 40% of ladies who have infertility have a psychiatric issue. Now, what came first?
Yeah.
Which led,
Right.
So, no, it's very frustrating. Okay. But like I said, it's, we have ways of getting around it. They've gotten very good with in vitro fertilization now.
Mhm.
Okay. And for a lot of these ladies, if we can't find a reason for why you're not getting pregnant, the next step may be that.
Mhm.
Okay.
Right.
And the problem then is the cost.
Sure.
Okay. I mean, you're talking $25,000, $30,000. Okay.
That's
Really
how much
want
in
that
vitro
baby.
is.
Oh yeah, easily.
Okay.
Easily. Now, some insurances will cover some of it. Some insurances won't cover anything. It just depends. I have a lot of patients now that are going out of state because now you can shop around for an infertility doctor.
Interesting.
And what they'll do is they may go to New York. They'll come here. They'll get all their labs done that the doc in New York wants. They'll go there for the consult. They'll go there for the embryo transfer, whatever. If that's what they're going to do.
Wow.
They come back to us for all their ultrasounds. So we can make it work. But once again, it's a big cost. The other big thing we're seeing is surrogates.
Yes.
We've got a huge population of
Mhm.
ladies that are surrogates coming here. Okay, for whatever reason, the couple that's
Well,
they're acting
same-sex
as.
couples sometimes can use surrogacy. Yeah, people with infertility,
Right,
or who have had,
or other health issues that they're not a good
yeah, that they
candidate
can't get pregnant
to be pregnant.
Sure.
Then certainly, yeah, we got those things. So there's lots of options out there.
Yeah.
Okay.
Yeah.
There's adoption.
Mm-hmm.
Huge need for adoption.
Right.
Okay, so
that's pricey too, though.
yeah, which seems so ridiculous.
It is
It
ridiculous.
ought to be damn cheap.
It should be.
So I don't know, but like I said, you got lots and lots of options, and sometimes you just got to come in and sit down and talk about
Sure.
it.
Mm-hmm.
Okay.
Okay.
And sometimes reality may be you're not a good candidate to get pregnant, unfortunately,
But let's talk about this way. Let's talk about getting you some kids.
I see a fair number of pregnancies where there was a sperm donor, husband and wife, but they had to use a sperm donor because husband had an issue. We've seen embryos that have been, couples have gone and gotten embryos from somebody else,
like a donor egg and a donor sperm.
embryo. Yeah,
it's just a donor embryo that's not, and they just put it in there, and then you grow that baby, and it's your baby.
She's pregnant, and off she goes. Yeah, so I mean, there's lots of different options.
Sure. Okay. Well,
Just
thank you so
open
much.
mind.
I appreciate you cleaning this mess up for us. Oh,
It was kind of rude.
I'm sorry.
It's a sign of intelligence.
I
It is,
know.
I said
It's so
that.
clean in here right now, though.
I know, it's driving me nuts though.
So now you're gonna be stupid.
I'm gonna have to trash it.
I know,
when you guys leave.
We're gonna have to trash
Hayden
it.
and I will trash it as soon as we're done here. We're gonna cut, and then
No, I'm afraid of what you guys might find in here. So no.
I already found a baby.
some
Yeah, you
weird,
did.
weird, scary baby down there in the corner. There's crackers in here, snacks, juice boxes.
Don't be a hater.
Don't be a hater.
All right.
Come in.
Thank you so much. Appreciate you.
That was fun. Let's do it again.